you like this video, make sure that you hit that like button below. Also, share this video with your friends. Leave me a comment in the comment section.
In a recent conversation, a colleague stated to me, "Fred, I think that if a person is really doing a 12-step program, then they don't need therapy. The program is a gift from God, created for people with substance use disorders. It is the only solution." I have listened to these type conversations many times after treatment team meetings. I have had similar conversations also, concerning people who take medication. My colleague augured, if you have a substance use disorder, you shouldn't be taking medication. They are triggers. It's only a matter of time before the user begins manipulating the prescription, eventually returning to illicit drug use. They are both interesting points of view, but dangerous. And their devotion and fanatical support of the 12-step program is dangerous. At risk is the lives of alcoholics and drug addicts. Quite simply, these opinions are dangerous, arrogant, and misleading. They are also a misrepresentation of 12-step programs. Let me be clear with some self-disclosure. I suffer from a substance use disorder. I'm not bipolar or schizophrenic, but I do suffer from acute depression. I am diabetic also, and I must take medication. I do not need any additional medication. I do not take medication that is not prescribed for a specific reason. Based on research and science, I weigh my options and what I can do to safeguard my recovery. I'm a psychotherapist, not a physician. Most people who discard therapy and medication are most likely not physicians or trained professionals either. As a result, they have an arrogant and dangerous opinion. For instance, let's take a contemporary situation that we often meet in a typical 12-step meeting. Let's call this person Brad, who is an alcoholic experiencing the holidays. He was sexually abused for many years and as a result has serious psychological issues that include depression. The physician at his treatment center has recommended 12-step meetings and aftercare with a psychiatrist. The psychiatrist offers hourly therapy and medication for Brad's depression. We will call this a recovery cocktail because it consists of 2 or more medications. From my professional perspective, that is not the end of the story. Brad is in therapy and recommended medication to cope with negative symptoms. If not taken, though, it will increase the probability of a relapse or something worse. What I would do is encourage Brad to follow his doctor's suggestion. Maybe you know someone like Brad, who is an alcoholic or addict and has a co-occurring disorder or mental illness like schizophrenic, bipolar disorder, depression. I know many wonderful members of the 12-step programs who take medication for a variety of conditions, including Viagra. So, what is the problem with an alcoholic or recovering addict requiring an antidepressant? Nothing. In past centuries, that were many substance users who suffered from various disorders. Today, many substance users still find relief in alcohol or drugs and mix various drugs. And the danger created by this combination of toxins is hard to access. Nobody really knows the brain damage resulting from these combined drugs. Clearly, the 12-step program for many is not enough. Research shows that many people who attend 12-step programs suffer from co-occurring disorders, hence a 12-step program is not enough. Why do some people in 12-step groups do not accept this safe and researched position? Recount the 2 comments made to me at the beginning of this talk. How can they discount the science of therapy? How can they overrule the diagnosis of a physician? In the world of religion, we met similar individuals who say that faith is enough to face any difficulty. No surgeries or operations, no blood transfusion, no inoculation or taking vaccines, or basically no use of anything outside of church therapy. I applaud their commitment, but their decision can be disastrous. Many family members, children, and friends in the church have died because of these religious beliefs. In a sense, they are like 12-step group members who disregard 12-step facilitation, therapy, and medication. The problem is that these types of people are disregarding science. The one important thing about science is that most of it is often based on research. Scientific research provides proven theories and concepts that are based on facts. Let's step back for a moment. Misinformed fanatics collectively lack balance and tolerance. What can be done about these 12 steps fanatics? Fortunately, they seem to be a dying breed. I know they mean well, and they love their program or their religious dogma. However, the narrowness of black and white thinking clouds their objectivity. What can we do as professionals who support the premise that therapy and medication is evidence-based treatment for people with co-occurring disorders? One thing that we can do is confront them when we can. Talk about the dangers related to their opinion and the still suffering alcoholic or addict. State the high number of alcoholics and addicts who relapse or commit suicide when they come off their medication. State the benefits of 12-step program, therapy, and medication. I believe that we have an obligation to confront arrogance, prejudice, and ignorance. We can confront it in a gentle way, however, confront it, we must. Here is a cautionary quote from philosopher Alfred North Whitehead. Not ignorance, but ignorance of ignorance, is the death of knowledge. Let your voice be heard. Show your support for therapy and medication.
Hi, this is Fred. If you like this video, make sure that you hit that like button below. Also, share this video with your friends. Leave me a comment in the comment section. Please subscribe to my channel or visit my website at www.StensonEnterprisesInc.com for more information on training and services. Keep it real, and I will see you next time.